sanitizing my hands. Retake. Start off by sanitizing my hands. Donning my gloves. Knock on the door. Hello, Mr. Marcus. My name is Jerby. I'm the nurse in your care today. May I come in? Perfect, thank you. So, hi. Do you mind? We're gonna be doing a wound care check for you today. Do you mind if I just check your ID band? Perfect. And then can you please state your name and date of birth? Perfect, thank you so much. So, I'm coming in today because we're gonna be changing your wound. And then we're gonna just analyze your wound to check if there's any like infection or anything of the sort. And then we're gonna replace your wound, and that's what we're gonna do. So is that okay? Perfect, thank you. And then before we start, do you have to go to the washroom? No? Do you have any pain or discomfort? Perfect. So I'm just gonna put up the curtains to provide us with some privacy. Great, and then I'm going to move the bed to a working level, and let us begin. So, just to start off, I will be opening this, and I will have another nurse help to lift you on here. Perfect, thank you. I'm just going to use this as so I'm going to take this out, and I'm going to use this as a garbage with my medical tape. I'm just gonna check here. Take this off. Thank you. So there is a little bit of redness on the bandage. That's fine. But other than that, there isn't any signs of excess drainage. There isn't any miscoloring, and everything seems to be like an appropriate amount for this wound that you have. So I'm just gonna get started by checking your dressing, and before I do that, I'm going to take off my gloves. Please open my kit. Space and making some things. So yes, perfect. Everything from one inch back here. Perfect. Great. I'm gonna take out some of my supplies. So as I take out my supplies, I will just be adding in some extra supplies. Sanitize my hands again. Sanitize my hands just because they felt dirty. Adding some extra. Perfect. adding some extra PPE. I'm cutting this to the right size that it will be. Then I'm going to look at my normal saline, confirm that it's normal saline, and the date it is not expired. Open it up, flip it, and pour it into my container. This back up. Cover. And now that I have all my supplies, I'm just going to resanitize my hands. Perfect. Now I'm going to open my sterile gloves. Using the proper sterile format. So yeah. So let's start off. Oh shit, I hadn't touched that. To start off, I will be measuring the wound. Perfect. And checking how long it is. 1 centimeter. 5 centimeters. And 1 centimeter. So it's 3. Draw that out. And because these are sterile, I'm going to complete this myself. And I'm just going to fill this with normal saline. Pour it onto my patient just to remove any excess bleeding. And I'm just going to help the patient. Well, I'm gonna ask my nurse. I'm gonna help my patient tip over just so he can leak. So I'm gonna ask the other nurse at hand so my hands are still sterile. Alright, and then to start off, I'm going to grab my tweezers. Put it into my normal saline. Drain out my normal saline. Put it into a clove. Wipe one side, throw it out. Grab another. Please leave. Drain it. Pinch and make it into a clove. Grab one side, roll it down, throw it out. And then I'm just going to grab another and pat the area dry. Throwing this out. Now that the wound has been cleaned, I'm going to create my gloves because my gloves are sterile. Bring it out. Now, patience. And I will put padding and another one. And I will get my medical tape. And cover all four sides. Stone it off. I'm going to pinch it, roll it out. Squeeze his hand. 2 fingers. Pinch this out. Throw this in the garbage. And I am going to clean up my area. Go to the garbage. I'm going to hand hygiene. And then ask the patient. So the care is done. We replaced your wound. There didn't seem to be any excess bleeding. Everything appeared to be healing normally, which is a very good sign. How are you feeling? You're okay? Great. So I'm just going to be documenting that the wound has been changed and that you are feeling okay. And just so you know, are you comforted? You're okay. There's no abnormal feelings you're feeling. Your wound is okay. Perfect. So I'm done. Do you have any other questions for me? No? Okay. Well, I'll see you again later. Take care.